You're listening to the Heart of Giving podcast with Art Taylor, powered by bbbgive.org. Here we explore the motivations that form the basis of giving and service. We inspire generosity and celebrate the transformative effects that giving and service have on the human spirit and on community. The conversations featured on the podcast also uncover giving strategies that educate and provide tools to help listeners make impactful gifts of both their time and money. We hope you enjoy this episode.
This is the Heart of Giving podcast, powered by bbbgive.org. Give.org is the nation's standards-based charity evaluator, and it's your one-stop source for information on giving and reports on the most asked about charities. I'm Art Taylor. Today, we're going to talk about an organization that is working in Central Appalachia to help people who frankly don't have health care. And her organization, the Health Wagon, goes to these people in mobile health units to make sure that they're getting some of the basic coverage that people need in order to survive. And my guest today, Teresa Tyson, is going to tell us all about this amazing work. Teresa, welcome to the Heart of Giving podcast.
Well, thank you for having me, Art. I would be more than happy to tell people about the Health Wagon. We're St. Mary's Health Wagon. We are a nurse practitioner managed clinic, and as you said, here in the Central Appalachian Mountains, in the westernmost portion of Virginia, in the beautiful mountains. We were founded by Sister Bernie Kinney. She was a Massachusetts Catholic nun that came to the region due to the inherent poverty of the area, and she actually started the clinic, first of all, out of the back of Volkswagen Beetle, just going up and down these mountain roads. And that was over 40 some years ago. We have since grown. I came on 31 years ago. I was her first full-time employee. I started out as a registered nurse and went back to school and got my master's and then later on my doctorate degree, so that I could follow really in her footsteps and give, much needed care here in the mountains, because this is a very vulnerable population. We have the singular industry of coal, and that has, pretty much been kind of wiped out. And with that, leaves a lot of individuals without a lot of needs, including health care. And that's the reason that we had to get really resourceful in the way that we were thinking and delivering care. And Sister Bernie was at the forefront of that with mobile care. We're the oldest mobile free clinic in the nation, as well as we have 2 stationary clinics, as well as a new pharmacy that we just opened up. Again, all these services are free, and we also have a dental clinic that we opened up last year as well. So we feel that we have a very unique model in that we really look at the patients holistically, as Sister Bertie taught us to do many, many years ago. And we, including in that, is not only delivery of health care, but looking at the social determinants of health, because there's a lot that goes in to making someone healthy. So just recently, in August, we delivered over 2,100 families, 2,100 individuals. We had a Davies back to school shuffle, and that's again with the social determinants of health. We wanted to make sure that the kids were equipped what they need to succeed in school. And so with that, we gave out backpacks and clothing and food boxes, because we see a lot of food insecurity. So we just don't do healthcare 365 days a year. We do meeting a lot of needs in the community.
Sounds like you're doing social services as well.
Yes, the social services is a large portion of what we do.
Given that, let me ask you how you determine the extent of the need there. What are we talking about in terms of poverty and people who are lacking health care and the kinds of social services that most of us would expect in order to have productive and decent lives?
So, Virginia is an incredibly, wealthy state. I mean, we have the most wealthiest counties in the nation. However, you juxtapose that against the other end of the state, as opposed to Northern Virginia. You go into the southwestern portion of the state, into the mountains, and there's no other state in the nation that has such extremes in healthcare or disparities between the have and the have-nots than the state of Virginia. That's something that we're not very proud of. We still got a lot of work to do here in the far southwestern portion of Virginia. And unfortunately, that translates into a lot of healthcare disparities. We are really just plagued with a lot of chronic diseases. Um, and that's the reason that the Health Wagon, I feel that we have to get very resourceful and think outside the box. We are really known for our outreaches as well. That being remote area medical Wise County that we've essentially had for 25 years. We've kind of rebranded after the founder of remote area medical passed away, Stan Brock. We renamed it Move Mountains Medical Mission. And this is a large outreach where we do free eye, dental, and medical care. And we do the dental care in conjunction with the Virginia Dental Association Foundation and the Mom Project. But this is, we typically have had this over a weekend, 3 days over the weekend, sometimes 2, sometimes 3. And we're anywhere from 1,500 people to 3,000 patients would come out for that weekend. It looks like something out of a third world country when people come and they line up for health care. We've had people that have came and lined up as much as a week in advance, to have their teeth pulled or have eyeglasses made. So we use that as a kind of a spoke and hub. So we do a lot of outreaches, and then we either take the mobile unit into the communities to give access to health care, or we use those outreaches to filter them back into our stationary clinics. And here at our stationary clinics, we do a lot of wonderful things, like we do telediagnostics. We're the first in the world to be doing telecystoscopies, looking for bladder cancer. There's a lot in the bladder. We're the first in the world to do that over telehealth. So telehealth has been extremely important to us, for us to have, and we have been doing that for 30 some years here. So we look at all the different resources that we need to develop and have on hand to bring care to this much needed population. I don't think there's a clinic out there that's really like the Health Wagon. We actually get people, 1 or 2 a month calling us, asking us, how can I do this in our community? One of the latest advancements that we are working on is SpaceX Starlink. We have put 50 units in 2 different counties for a total of 100 in some of the poorest counties here in the far southwestern portion of Virginia, and so that we can link individuals with healthcare access, because they do not have the patients do not have internet. And so this is kind of a pilot project with us. But with that, we're also looking at, when we put internet into those homes, we're giving those children a chance in the homes, to have internet access to do their homework, to enroll in like the social services programs like that you were asking about, and different things that we just take for granted, even like having the internet. And it also puts telework platforms into the homes as well. Again, we're trying to look at all the resources, like from telework, to bring opportunities for these patients, because they're a beautiful set of patients here. They're so wonderful.
Let me ask, can I ask you a quick question though,
Mm-hmm.
about the Health Wagon itself? What are we talking about when we say a wagon? What's in it? How does it work? What am I going to experience if you pull into my community?
So it is like it's like a doctor's office on wheels. I mean, we have one mobile unit that's strictly dedicated to X-ray, and that is run by pulmonologist Dr. Joseph Smitty, who's our medical director. So we do take that as part of our outreach. But on a typical day, the Health Wagon will pull into a community, and it is a 40-foot specialized Winnebago with exam rooms, and the specialty tables for us to do women's health exams and so forth. We can do everything that we do here right now. This is I'm speaking from our stationary clinic, but we can really do anything that pretty much that we would do here in the stationary clinic out on that mobile unit. We have it equipped so well. So it is state of the art, really clinic that is mobile, and we just take it out into the communities and set up, and individuals will either have appointments or we take walk-ins as well. So it's kind of a mixture of both, and we deliver some wonderful care to individuals that would not ordinarily have access to us. So that's the reason the spoke and the hub is so very vital to us. And then, like, if we have like specialty clinics, like a colposcopy clinic when we have women who have abnormal pap smears. A lot of times we bring those individuals back here to the stationary clinics because we can't do everything out on the mobile clinics, but most services we can. So it's just typically like walking in a little doctor's office, with 2 exam rooms, a waiting area, a blood draw area, and it's very nicely equipped.
I can tell. So when you come into a community, now you have people who are interested in getting help. First of all, how often are you able to get to a particular community? And is there like a regular circuit that the wagon goes on so that people who have particularly chronic illnesses can see a physician or a medical assistant to have those needs addressed?
Exactly. We do have like a circuit, so we'll see this community on like the first Tuesday, or this clinic on the fourth Friday. So, so it just really depends. But the mobile units are out pretty much on a daily basis, and then we combine that with a lot of outreach programs. Recently we've had areas that were devastated from the flooding, so we've been in Damascus. So although that wasn't our normal route, we deployed that to the Damascus community all last week, giving some very wonderful care, and set up alongside like with the health department, and we joined forces there and gave a lot of care. And then we would actually go out into the communities and canvass the communities and either bring people back to the mobile unit, or we did a lot of home visits like during this flood, getting people oxygen, doing wound care, tending to fractures and things like that. So very
Teresa,
versatile.
I can see you're high on this work. I can really see that.
I've been here for 31 years, and
Yeah,
I've loved every
31
minute
years.
of it.
Wow.
Yes.
And you actually got your degree to do this more fully, right? You were doing
Mhm.
some work, and then you were able to upskill so that you could do it at a higher level. Is that correct? Tell me about
That is correct. So, like I said, I started out as a registered nurse. Just this has really been my only job, fresh out of nursing school, and just I went back and got my master's degree after I seen what Sister Bernie was, delivering to the
Tell me
community.
about her. Tell me
Oh,
about
she's
Sister Bernie.
wonderful. She is my hero. I mean, she was she came here, like I said, 40 some years ago, over 40 some years ago, and just really started out Volkswagen Beetle at the request of the Richmond Diocese because of the poverty that was here in the mountains. And she's still doing great. She turned over the reins to me, I think it was in 2006, and I have just loved every minute of it, and I employ what she has taught me, every day. She was a Catholic nun, so she taught us, all about like social justice, and caring for our neighbor. And we have a rich heritage in the mountains anyway, coming from the mountain. My dad was a coal miner and so forth, but we really care for our neighbors. So it was very synergistic, her philosophy, and really the way that we care for individuals here anyway. So it's very, synergistic, because I think I know that, the Appalachian people, we are plagued with a lot of stereotypes. However, the most beautiful thing about the Appalachian people is how they care for, their neighbor and for another.
Well, how do you get support for the work? I mean, I know you mentioned being a part of many poor communities, and we're seeing that while people can volunteer and pitch in for their neighbors, of course, it takes some money to do what you're doing. Where do you get most of your resources from
Yes.
to do this
It
work?
it's a, I always say the care that we give is free, but it's really not free to the individuals, because we've got staff, we've got utility bills and so forth like that. So it is very expensive, especially due to the amount of people that we see. So we try to really, diversify our funding. We do seek grants when we feel that is um, when we have a connection to a grant that aligns with their mission. But I mean, a lot of it is just the small donors that will come forth and, make a $20, pledge maybe every month, or send what they can. So God has just always blessed us. So we really depend on those donors. Foundations have reached out to us. That has been very positive. a lot of foundational support. But that is the hard part. I mean, the patients here are very sick when they come in. They're train wrecks of patients, just to be honest. They will come in with a lot of healthcare needs, high blood sugars because of all the healthcare disparities that we have. They'll come in very sick. So sometimes that seems like it's the hardest part, putting them back together, getting their medication, getting their resources and stuff like that for them, and meeting the social needs. But at the end of the day, the hardest part has always been to keep the clinic going and to, try to write the grants and raise the money and talk to donors and keep donors informed. It's very hard and challenging, but I know that, God put us here for that reason. And I have a wonderful clinical director, Dr. Paula Hill Collins. She's also a family nurse practitioner, and she works alongside us and all the other wonderful staff that we have, and everybody just works so from the heart, to give such wonderful care. And we are truly making a difference here in the Central Appalachian Mountains, and we feel that we have a beautiful model that really needs to be replicated in other parts of the country, because it's not just Central Appalachia that has poverty. There's poverty pockets all over, but this model could be very well utilized elsewhere.
Yeah. So what is the model itself? How would you describe what you would call the model?
It's an I would describe it as kind of a unique model. It's an what I would call integrated care um, continuum model, where we have all these different resources that we are bringing to the health wagon. So, at the basis of all that is the health care. But alongside that is, we're providing dental care, because, oral care affects overall health of an individual. We've got a free pharmacy. We opened the first free and charitable pharmacy in the region in March of this year. And so it's very important to get patients the needed medications that they need. We combine that. Also, we have a strong focus on mental health as well. And then you look at the outreach, and us addressing like the social determinants of health. I think when you kind of in the specialty care, we're able to provide specialty care to the individuals, teleradiology, telediagnostics, our telehealth platform. When you combine all that together, I think that we have a very unique model. We're not even really akin to like a federally qualified health center, which we're not, but that would be probably the closest thing that we are, because I think we even elevate it beyond what an FQHC, what they do, because we're actually out there doing more in terms of outreach and looking at the social determinants of health, and just try to bring all these resources to the individuals. So at the end of the day, that they have the best possible chance at living the most fulfilling life that they could.
Yeah. One of the things I wanted to ask you about was volunteers. I would imagine that some of the support you get just comes from people who are willing to give their time and energy to make this all work. So how do you deploy volunteers in this model?
We love our volunteers. They actually will come alongside us, especially at the outreaches, is where we really utilize volunteers. At the height of our remote area medical Wise County, we were having 1,500 volunteers come in for that weekend. Now, we've took a hit after COVID, as everybody has, and we're still trying to recoup from that on a daily basis. But we really love having our volunteers. Some volunteers will come maybe and help at the clinic for a day or two. Some will come and stay a week. We love our students. We have affiliations with over probably 60 universities and colleges. So, some may make it come and do projects for us. Some may come, work in the clinic, such as nursing or medical students and so forth. So we do, in that same capacity that we use volunteers, we love to have our students with us as well. And some will come for a day, some will come for, several months at a time. It just depends. But we're always looking to bring additional resources to us.
Wow. That is unbelievable. And I just think about organizations that deploy volunteers and the amount of work involved in just getting them squared away, recruiting them, making sure they know what their responsibilities are. How are you able to pull all that together? What is the secret to that?
Oh, it's a God thing. I mean, we could not do this on our own power and our own might. I always say that, and it's just amazing how we're able to, bring all this together. I can't really explain it. It happens, but I've been here for, like I said, 31 years, and I'm amazed at it every day at how we're able to deliver care in the fashion because we don't have resources here. We're in the
Right.
far southwestern portion of Virginia, and we're in a very resource poor area. But just by the grace of God, He helps us out daily in those areas.
Well, I got this
God is
story.
good. He's good to us every day. I mean, there is miracles. There's not a day that goes by that people are or their lives are not changed or saved here at the clinic. So it's very wonderful. It's very rewarding work, and my staff are just amazing, and the people that volunteer with us are just incredible.
Wow. I don't know what to say. You've got me tongue tied. I mean, it's just, first of all, to take this on for the length of time that you have and make it a life commitment, and to expand it in the way that you have so that you're not only dealing with the medical needs of people, but some of the precursors to those medical
Hmm.
needs, whether that be social services, education, access to resources that people don't have, bringing medicine to them, pharmacy, and the numbers of people that you've served and are serving. It's just it's just unusual, and it's very special. And I talk to a lot of people, Teresa. I talk to a lot of people about amazing things that they're doing. But I have to tell you, this is right up there. This is
Oh,
right up there. You're dealing with people who have nothing,
yes, yes, yes.
and you bring them hope
Hmm. Yes,
that the things that they're dealing with can be addressed,
yes.
and that somebody cares. If nothing else, somebody cares.
Hmm.
So I'm really moved. I have to say, I'm really moved by what you're doing. Let me ask you, my students, I teach at Columbia University,
Hmm.
and these young people are learning about leadership and management in nonprofits. I wonder what you might say to them about how your journey has gone as a leader and a manager, and what special advice you might have for them, because I know they're all going to watch this. So
Hmm.
speak to them directly.
So I think, sometimes, when we're contemplating maybe a project, maybe such as this, I mean, sometimes it's just to take that leap of faith and do it, and maybe don't overthink it. That's what I tell a lot of people that, they'll call, okay, how do I start a mobile? I think, you start talking, I just think this is too much. I'm like, no, just start. You're not going to be what we are now, but we were not what we were, 40 years ago. Just take that leap of faith. If God has called you to do it, then He will pay for it. He will make it possible. And so just take that leap of faith and go forward and put one foot in front of the other and try and start it. And I mean, and certainly we want to, put every safeguard that we can to make it successful. But sometimes I think people get just hung up on making that first initial step.
Hmm.
Just progress, go forward and go forward another day and another day and another day.
Yeah.
So,
Well, that's advice not only for my students, but for all of us.
mhm,
I mean, there are people out there right now, for instance, Teresa, who think that they don't have enough to give anything, and don't realize that nickel, that quarter, that dollar, that $50, $100, whatever you have to give matters. It matters a lot. And don't think that because you don't have a lot, or sometimes you don't have much of anything, that your gift doesn't matter. It does matter. In fact, data has shown for people who think they're not making a difference, the person who receives your gift, it matters a lot more to them than you think it does.
True.
It matters a lot more to them than you think it does. And so your message here about just doing it, getting involved, doing what you can, has such an important effect on people who are receiving what you have to give. And I'm looking at you too, Teresa, and I know that what you've given has changed you. Talk
Yes.
about that. Talk about how the things that you've given, the work and the time and the effort that you've put into building this, how has it changed you?
You can't do this work and really not be changed. I mean, it really just changes you here at the heart level, and I absolutely love every day of taking care of this unique vulnerable population, a population that I feel has oftentimes been forgotten by, like the rest of the nation, because the success of this nation was born on the backs of these coal miners, my dad included, as a coal miner. And, I do this for the love of the people that I have. They're beautiful people. My dad, he was such a hard worker, and he's 84 now, but I remember when I was a little girl, he would tie a belt. He had a herniated disc, and anybody's ever had a herniated disc, you get that sharp pain down your leg, and he would tie a belt around his leg so that he did not feel that pain. And so, I just do it from that aspect of helping another. That's what I was taught to do. My mom, she wanted to be on the mission field somewhere, and she had 4 children and never got that opportunity. But I'm on the mission field here daily, but it's in my own backyard. And so I feel like I am the most blessed person on this planet to be able to take care of and provide wonderful resources to the region that we're here in Central Appalachia. But you're forever changed at the heart level. You feel it here. And that's a wonderful change.
Well, Teresa, we're at the end, but I just wanted to again thank you for what you're doing and wish you all success in helping the people who are at this point somewhat helpless,
Yes.
and turning them into givers too.
Yes.
They
yes,
will. They'll be transformed too.
Yes.
This is the Heart of Giving podcast. You've been listening to Teresa Tyson, who is the executive director of the Health Wagon. They're doing amazing work in Central Appalachia to help people who don't have social services and health care. And if you tune in every Tuesday, you're going to hear amazing stories like this from others. So I hope you'll subscribe to the show. And if you want to, you can support the podcast too by going to give.org. And you can support Teresa by going to her Health Wagon website and putting a little something in their coffers and let them make a difference for people who need help. Thank you for listening, and I hope we'll see you back here next week.
You've just listened to the Heart of Giving podcast with Art Taylor. Be sure to tune in next time for a brand new episode. To listen to our other interviews, visit heartgiving.podbean.com. That's heartgiving.podbean.com. Subscribe to our show on major podcast platforms. The thoughts and opinions expressed on this podcast are the views and opinions of the guests, not those of the BBB Wise Giving Alliance or program affiliates. This podcast is for information and educational purposes only and is copyrighted with all rights reserved. This podcast is protected by Podbean's terms of service.